Welcome back to A Closer Look. I'm Linda Fontaine. Again, my special guest is Congressman Phil Roe. Thank you for joining us.
Thank you, Linda.
Well, we talked about veterans. Now let's touch on health care. In fact, like you said, we'll probably get deep into the weeds on this one because it's very important to a lot of people in our area, to people all over the country, but it's a little confusing right now. And I want to talk about that. Give me your ideas on what you're seeing right now.
Let me go through our system as we have it. And I think that's important.
Okay.
About 155 to 157 million people in the country get their health insurance through their provider, through their employer. And there are two ways. You can have just a basic insurance policy or a self-insured. For instance, when I was in Johnson City on the city commission, all the teachers and workers there, and I'm sure Kingsport's the same way, have a self-insured program. That means you pay the bills, you have an insurance company that adjudicates the claims. So that's about 155 or 57 million people, and I want to get back to that in a minute. Then you have about 74 million people, many of them children, that are either on the Children's Health Insurance Plan or Medicaid. So you got 74 million people, and you've got some elderly and other people that are in there. And Medicaid originally was put together for pregnant women, for elderly people and disabled people. And that's since been expanded. And then you have Medicare, and about 47 or 48 million people are on traditional Medicare, and about 10 million people who are disabled through SSI, Social Security Supplemental Income. After 2 years, you can apply and get that, and anyone who needs kidney dialysis is also on Medicare.
Okay.
So that's about almost 90% of the population of the United States. What's left are the small group and individual market and the uninsured. And what's happened is in the small group market, that's where the pre-existing condition issue came in. If you are in the group market, it's been against the law since 1974 to discriminate on the basis of a pre-existing condition. In other words, if you get your insurance through your employer, you cannot be discriminated against. If whatever disease you have to be accepted.
Right.
If you have Medicaid, the same thing. If you have Medicare, the same thing. So again, the pre-existing condition is only the individual. It's a person working out with a small art shop, let's say, or a small business with 2 or 3 employees. They can be. So what the Affordable Care Act did in 2009, and it was passed in 2010, it set up exchanges where you could buy insurance through that exchange. The Congressional Budget Office estimated in 2010 that there would be 22 to 24 million people on that plan. There are only 10 million people on that plan. And there were 2 aspects of it. One was Medicaid expansion, and there have been about 30 states or so that have expanded it. The others have not, and we'll go into why in a minute. And then the other is the small group market. So I want to go to the Medicaid expansion. It's been a big discussion here in Tennessee.
Yes.
Tennessee expanded Medicaid in the early and mid-90s called TennCare.
Right.
And what happened was it grew so exponentially that it was taking up 80% of all the new tax dollars that the state took in. So education wasn't getting the money, roads weren't getting the money, so then Governor Bredesen had to cut the rolls. I mean, that was a painful thing to do. What Medicaid is funded by something called an FMAP. That's a federal formula about how each state gets money. Each state's not treated the same. Tennessee doesn't get as much money as New York. So it pays, if you have a Medicaid person that state's taking care of, they pay about 65 or 66 cents. The federal government does. The state has the responsibility for the rest.
Okay.
When they expanded Medicaid through the Affordable Care Act, it did something different. It took able-bodied people for the first time and paid 100% of theirs, and then gradually went down to 90%. So the state was only responsible for about 10% of that bill. What the state of Tennessee is concerned with is that, hey, what happens when you've got a budget crunch and a budget deficit like we have now, and we say 3 years from now, oh, this is all fine, but we're going to treat all Medicaid patients the same. So we're going to cut that reimbursement from 90% down to 65 or whatever your number is, and the state has a huge hole in their budget. That's what they're afraid of. What we did as Republicans, and the bill I helped write, and Dr. Cassidy, who is a senator from Louisiana, and I served with him for several years in the House, put forth a plan that said, we're going to treat all this money the same. And we're going to take the ACA money, and we're going to take the traditional Medicaid money and we're going to send it in one big block grant to the state of Tennessee or Minnesota, wherever, and let them decide how they provide insurance for low-income people. I think that's absolutely the way to do it, because how in Washington, D.C. can I know what's best for inner-city Detroit, Michigan, or rural Maine? I can't. Let them figure it out. So that's what we tried to do, and we failed by one vote in the Senate. The biggest obstacle, and we talked about this again off camera, to health insurance coverage is the cost. And I'll give you a perfect example of that. In the 1st Congressional District, there are about 20,000 people that get ACA insurance. 90% of those, it's subsidized, so they're protected. In other words, they get taxpayer dollars to keep their rates affordable. But there are 10% of the people who buy the insurance who don't get subsidized, who don't meet those incomes. And I met a man in Cobb County the other day whose family, his insurance is $33,000 a year. I have ACA insurance. I decided that if my constituents had to have it, I would have it. So I did. And mine's about $20,000 a year. I can afford that, but most people cannot.
That's not affordable.
It's completely not affordable. And in the well, I tell you how bad it is. In the 1st Congressional District, almost 15,000. Remember, 20,000 got the insurance, and most got a subsidy. But 15,000 people, because they couldn't afford it, paid the penalty or a tax. They paid the IRS.
Yeah.
And what's wrong, to me, what's wrong about that is the federal government coming out and telling you what you must buy, these 10 essential health benefits, and then when you can't afford it, we fine you. That's wrong. And what we should be doing is looking at a way to lower the cost for all of our citizens. That's what we should be doing.
I'm concerned too from one standpoint, because I have a son. I was paying $300 a month for him to have insurance privately. Well, from December to January, it went to $600 a month.
Which can't
Healthy guy, 21 years old, healthy as could be, no illnesses, nothing. I thought, what? This is such a paradox. I mean, this is really ridiculous. They call it affordable, and it's become ridiculous. How can we have affordable and attainable health care in this state?
Here's the reason that happened. You probably don't know the reason.
I probably don't know the reason.
Here's the reason why. Because in the ACA, the Affordable Care Act said, okay, we're not going to age discriminate. For instance, your son and me, I would normally pay 6 times what he paid. So we did something called community rating and age related, meaning that you could only charge me as an older person 3 times what you could charge your son, who's a younger person who should be able to buy insurance. Look, I say this as a joke. I have 2 sons. The only reason you insure young adult males is for stupidity, for the most part. They just do dumb stuff.
Right.
They jump off this. They do this. They do that. And so it's really just a basic coverage. Most of them are healthy, very healthy.
Yes.
So they did that, and they did community rating, meaning that you couldn't charge anybody more because of a condition that they had. So what did that do for young people? It jacked the price of theirs up, and guess what they did? They voted with their feet, and they got out, and guess what happened? The pool of people you insured got smaller, and the cost went up. So what we did in our bill that we passed was we created, there are conditions out there, and I saw patients when I was in practice through no fault of their own have had cancer or diabetes or whatever it is. Look, those things, people have those happen.
Yeah.
We shouldn't punish people because they have something they couldn't help. And we devised a plan that did just that, and it's called an invisible high-risk pool. It's been used in Maine. So if you came in with a high-risk condition and you didn't even know you had it, you just bought insurance in the pool, and the pool covered those high-risk patients so they could have affordable insurance, and your son could have affordable insurance. And guess what happened in Maine? The pool went from 32,000 people to over 100,000 people. The price for young people went down. The price for older people went down. Why? Because you shared the risk through a larger pool.
Yes.
A couple of other things we did, which make absolutely no sense to me whatsoever, is why in the world can you not buy health insurance across the state line? You can buy any other insurance in the world across the state.
That's what my partner Steve and I on the radio this morning were talking about, not on the radio, but in between, we're like, how come we can't do this?
Yeah, you can buy, look, I use Geico. You know, they had this great ad, a little gecko jumping across the state line in Bristol. So that's how I tell everybody, well, they said, what district? I said, have you seen the Geico ad? Oh, yeah, that's where I represent. And what that means is I can't walk across on the Bristol side, on the other side of the street, and buy health insurance. That makes no sense. You
It
can
makes
buy
no sense.
every other insurance in the world, on the internet, whatever, as long as it's covered and follows the rules of the state insurance people. And the Trump administration just did a rule where you can do that. The second thing you've got to be able to do is a young person like your son has got to be able to get in a larger group.
Yes.
And what we've done is to allow people to have association health plans. So maybe it's outdoor outfitters that do that, or whatever. So we're doing that now, and that will help bring the cost down.
Well, I hope so, because right now we don't know what to do for him.
Well, Bill Gates is not going to be able to afford health insurance if we don't get a lid on it. And it's more complicated. We've got prescription drug costs. We've got a lot of things we could talk about. But you've got to have young people buying insurance.
He doesn't live a conventional lifestyle, and it seems like you have to, unless so you can get through work or
Yes,
get through
do
something. Because he wants to live in a different lifestyle, doing what the job he does. It's really not affordable
and we should
for
be
him.
able to get an association plan that he could join to buy the kind of insurance that meets his needs.
Absolutely. So what we're going to have to do is have you back on the show and discuss this more, because time went by way too fast.
It did go fast.
And I have a lot of things I want to ask, but I can't. So you have to come back on soon. Promise
Glad
me
to.
that.
Yeah.
All right. Thank you so much for being on
Thank
today.
you. Thanks so much.
I
Thanks for
appreciate
having
you
me.
so much. And we'll be back this time next week with another edition of A Closer Look. So be sure to join me then. Have a great week.
You good?